On-the-scene coverage of AHA 13 is supported by Janssen Pharmaceuticals Incorporated.
Well, I'm Chris Cannon for On the Scene Video, here joined by my colleague and friend Deepak Bhatt, who heads up CardioSource's trial summary review. And we're here to talk about the big trials that are coming up at the American Heart Association. I think one of them is being presented by one of our colleagues. It's the fourth of the novel anticoagulants in atrial fibrillation trial, a huge trial. Engage, Timmy 46, I think?
I'll let you take that one. But it's a major trial. It's got two different arms of a novel anticoagulant, two different doses of edoxaban versus warfarin. And it's a very large trial that should add to our knowledge base about AFib and the role of novel anticoagulants. So not only is it a new novel anticoagulant, just I think the size and different dosing regimens should greatly advance the field.
That's terrific. Another area is aldosterone inhibition. This is being looked at not in systolic heart failure, but in diastolic heart failure, the TOPCAT trial.
That's right, heart failure with preserved ejection fraction, which we like to call diastolic dysfunction, where right now we don't know what to do with those patients. They come into the hospital a lot with heart failure, but it's not clear what we can do to improve their outcome, and perhaps aldosterone antagonism will be the magic recipe to actually treat them.
Yeah. And the final trial we'll highlight amongst many is a trial that's been over a decade in coming that the NIH has sponsored, the CORAL trial, looking at a renal angioplasty and stenting approach for renal artery stenosis with an eye towards preserving renal function.
So renal artery revascularization has evolved from surgery to balloon angioplasty to stenting, and it's become a very safe and effective technique. The key remaining question is exactly which patients might benefit. Certainly there appear to be patients that have critical bilateral stenosis that can benefit from the procedure, but should it be used more routinely in patients, for example, who have a unilateral renal artery stenosis and hypertension? And there's not a lot of randomized data supporting that, mostly just case series. So this is the first large trial to try to nail down the answer to that question. So positive or negative, it'll be important.
And certainly there's been renal denervation, a different intervention in that area that's been a big evolving area. You've been involved with that.
Absolutely, and of course those are non-overlapping patient populations because at least for the time being renal denervation is being done in folks without significant renal atherosclerosis, whereas CORAL is examining patients with significant renal artery stenosis, but it could potentially expand the way that we treat hypertension. On the other hand, I wouldn't be shocked in this sort of generalized all-comers type population if it's potentially Courage-like in its findings, that is, not clearly showing benefit, though there may still be benefit in particular subgroups.
Yeah. Well, it's amongst the very good trials that will be presented. Also a lot of trial updates, additional information from some of the recent big trials that have been presented. And we'll be covering it all with video and trial summaries, news reports from AHA. So stay tuned here on the scene at the AHA 2013.